Hello everyone and welcome back. My name is Dr. Ben Osevwe. Today we are going to talk about somatic symptom disorder in a simple, clear and practical way. This lesson is for PMHNPs, students, families, caregivers and anyone wanting to understand distressing symptoms. By the end of this video, you should be able to explain somatic symptom disorder, its causes and social factors. We will also discuss treatment options and nutritional or vitamin supports that may help overall health. Short disclaimer. This video is for education only. It is not medical advice, diagnosis, or treatment. Physical symptoms should always be evaluated by a healthcare professional. Seek emergency help for severe pain. If someone feels unsafe or has suicidal thoughts, call or text 988 for the Suicide and Crisis Lifeline. Part 1. What is somatic symptom disorder? It is a condition where physical symptoms cause extreme worry. A person has physical symptoms like pain or fatigue and becomes preoccupied with those sensations. Somatic symptom disorder happens when the body has symptoms and the brain's worry system gets stuck. This does not mean the person is faking. The pain is real. The fatigue is real. The distress is real. The suffering is real. The main feature is spending a lot of time and energy worrying about body signals. Merck Manual explains that the worry must cause distress and interfere with daily functioning to be SSD. Part 2. What it can look like. Somatic symptom disorder can look different from person to person. Some people may have pain, headaches, stomach problems, or dizziness. Others feel body aches and nausea. Symptoms can also include shortness of breath, chest discomfort, or feelings of numbness and tingling. The person may frequently check symptoms, search online, or visit multiple healthcare providers. They may ask for constant reassurance or feel unable to relax because they fear something is seriously wrong. The body symptom may start the problem, but the fear around the symptom keeps the cycle going. Part 3. Neurological root causes. Now let's talk about the brain and how it communicates with the body. The brain has an alarm system that watches for danger. It constantly asks, is this body sensation dangerous? In somatic symptom disorder, the alarm system may become too sensitive, treating a small sensation as a major threat. The brain receives signals from the body all day. Most are ignored, but here the brain turns up the volume. A simple way to explain it is, the body whispers, but the brain hears it like a loud shout. Stress can increase cortisol and adrenaline, which cause real sensations like muscle tension and fast heartbeat. These chemicals lead to stomach upset, headaches, and fatigue, which the person then notices and worries about. That worry creates more stress, and more stress creates more symptoms. It becomes a self-sustaining loop. Chemicals like serotonin and dopamine affect pain sensitivity, mood, and how we perceive our body's signals. SSD isn't just one chemical being wrong. It is a brain-body communication problem involving fear and attention. Part 4. Psychological root causes. Certain psychological patterns can keep these physical symptoms going. The person may experience intense health anxiety thinking, what if this is cancer? Or what if doctors missed it? They may fear they are going to die, or that every small pain means something absolutely terrible is happening. Catastrophic thinking means jumping to the worst-case scenario instantly when a symptom appears. For example, a simple headache is interpreted as a brain tumor, or a racing heart as an immediate heart attack. Past trauma, medical trauma, or childhood illness can make the nervous system stay alert to body symptoms. Loss, abuse, or chronic stress trains the brain to monitor every sensation for signs of potential danger. The person may feel better after a normal test result, but that relief is often very temporary and short-lived. Soon the worry returns. The cycle continues. Symptom, fear, checking, temporary relief, and more fear. Part 5. Social root causes. Somatic symptom disorder can also be shaped by a person's environment. A person may have grown up where emotions were ignored, but physical symptoms received significant attention. Social stresses like family conflict, financial stress, work pressure, or loneliness can worsen symptoms. Caregiver burnout, medical mistrust, or feeling dismissed by providers also play a large role in distress. For PMHNPs, it's critical to validate the patient without ordering endless, unnecessary medical tests. You can say, I believe your symptoms are real, and I want to help reduce the fear they are causing. Part 6. Treatment options. The good news is that somatic symptom disorder is very treatable. Diagnosis includes medical evaluation and often a referral to a mental health professional for support. Psychoeducation teaches that symptoms are real, even if the nervous system is just stuck in alarm mode. Having one trusted primary provider reduces repeated emergency visits and avoids unnecessary testing. Cognitive behavioral therapy helps patients identify catastrophic thoughts and reduce symptom checking. Mindfulness, prayer, and relaxation skills like progressive muscle relaxation can help calm the system. It is also important to assess and treat co-occurring conditions like depression, anxiety, or insomnia. Medications like SSRIs or SNRIs may be considered when anxiety or depression is part of the clinical picture. Part 7. Nutrition and vitamins. Good nutrition can support the nervous system. Focus on regular meals with fruits, vegetables, whole grains, and lean protein to support overall health. Limiting excessive caffeine and alcohol and avoiding unregulated detox products is also very important. Nutrients like vitamin D, magnesium, and omega-3 fatty acids may support overall nervous system wellness. Always talk with a healthcare provider before starting supplements, especially if on psychiatric medications. Part 8. How to explain it to a patient. Use simple analogies that validate their experience. Say, "We are not ignoring your body. We are helping your body and brain work together more calmly." Part 9. When it is an emergency. Certain symptoms always require immediate medical evaluation. Seek help for chest pain, severe shortness of breath, fainting, or new neurological symptoms. Seek urgent help for suicidal thoughts or confusion. Call 988 or seek emergency care immediately. Today we learned that SSD happens when physical symptoms and the brain's worry system become stuck. We reviewed neurological, psychological, and social causes, along with effective treatment options. The goal is not to dismiss symptoms, but to reduce suffering and help your life function better. Again, my name is Dr. Ben Osevwe. For support, you can text 832-991-6516 today. Please subscribe to our channel and join our mentorship family at rotationmatchnetwork.com. Thank you for watching. Remember, with the right support, healing and stability are possible.